Welcome to the Brite Lounge Teeth Whitening Training video. In this training video, we will show you how to welcome the client, sign the consent form, how to measure teeth shade, getting the client ready, properly applying the whitening gel, how to use the laser, and client aftercare. These are all the items that will be needed to teeth whiten with your client. You will need a pair of gloves, a mask, the teeth shade, a bib, gel, protective eyewear, 2 water cups, Q-tips, a popsicle stick, and a Brite Lounge Advanced Whitening Kit that comes with the whitening gel, the teeth retractor, a wipe, and vitamin E oil. When welcoming your client in, ensure you do a minor consultation asking the following questions. 1. Have you ever gotten your teeth whitened previously? 2. Do you have any pre-existing sensitivity? Although most clients don't experience sensitivity during this treatment, if they have any pre-existing sensitivity, it is a good idea to be more cautious, as there can be dental issues we are unaware of. It is vital to have every client read and sign a consent form. This will set the proper expectations and determine if they are a candidate to this service. Just like the dentist, please ensure you have gloves and a mask on prior to working with the client. Hand the client a mirror and hold the shade gauge up to the client's smile. It is essential to be honest with your client. It is also completely normal for your client to be between multiple shades. Communicate what shade you believe they are. You are also able to remove that shade to get a closer look. You may then add that number to your client's chart for future reference. When placing the bib on the client, ensure it is glossy side down. You may then secure it into place using the blue bib strap included in your kit. Next, take a popsicle stick and pick up a portion of Vaseline or lip balm. Give the wooden stick to your client and ask them to apply a generous amount. This is to 1. Ensure their lips don't dry out during the treatment, and 2. Make the insertion of the cheek retractor much easier. It is important to feel comfortable with inserting the cheek retractor. Ensure the longer edges are facing the client, as that is what is being inserted in their cheeks. Staying controlled with the retractor, squeeze the 2 sides together with the handle and point each edge toward the client. You may then insert the retractor 1 cheek at a time. You may have to ask your client to bite or open slightly for full access to their teeth and to ensure their teeth are not touching any lips or soft tissue. You can also adjust their top and bottom lip into the retractor. This is the ideal time to take a before picture if you or your client would like one, with their consent. Open the finger wipe and place it on your finger. Using the blue side, make gentle circular motions to dry and prepare the teeth. This is to make sure there is no saliva or debris that can act as a barrier to the gel. You may keep the wipe on your tray, as you may need to prepare or dry the teeth in between each 15-minute session. Take off the cap and twist the pen several times until the gel begins to extrude. A portion of gel will appear on the tip of the brush. You can then swirl 1/3 of the pen's gel gently onto the back of your gloved hand. Take the brush and pick up a small bead on the end of the brush. Ensure the brush doesn't have excessive product, as that can lead to an imprecise application that would result to blanching, meaning whitening of the gums. Take the bead and apply it to the center of the tooth. It is very important you work tooth by tooth to ensure you are not getting any gel on the soft tissue, gums, and lips. Carefully dab the gel on each tooth up to the gum without touching it. If the gel touches any soft tissue, remove it immediately. Continue covering any tooth that will be exposed to the light. It is unnecessary to apply the gel to the back molars. The number of teeth you will apply the gel to will vary between clients, as they all have different smiles. Ensure you are applying a thick coat without running out of gel. Evenly disperse the product to ensure you will have enough gel to perform 3 rounds. Either place or ask your client to put on the red glasses. These will protect their eyes from the laser. First, set up and plug in your Brite Light 6200. Set the preset 1 to 15 minutes by holding down the button. The light can be a little tricky to line up. It is super important to not twist or turn the end of the light, as it can damage the wiring. Use the neck of the Brite Light 6200, swivel it into place. You want the light 1 to 2 inches from the client's teeth. Using the preset 1 timer, after the light is lined up, click the play button. The light will beep once at 1 minute and 3 times when it is done. When your personal timer beeps at 1 minute, head back into the room, pop on a pair of gloves, and fill 1 Dixie cup with water. Once the timer beeps 3 times, swivel the light away from the client and take the retractor out of the client's mouth. Have the client sit up and drink the water, swish and spit into the other empty cup. Ask your client to swish a few times to try to get as much gel out as they can. Dispose of the liquid in a sink. Repeat the same process 2 more times to get the client the best results. After repeating 2 more times, once the client has spit out all of the gel, show the client the results. You may then go in with your vitamin E. Remove plastic packaging. Hold the swab vertically with the red line to the top. Break the swab at the red line and vitamin E will disperse down into the opposite end. Once most vitamin E has emptied, you may apply it to the gums and lips. This step rehydrates and moisturizes the soft tissue. Note: if blanching had occurred during the appointment, apply extra vitamin E to that spot and advise your client to brush lightly for the next 2 days as their gums may be sensitive. Measure their post-treatment teeth shade. Hand the client a mirror and hold the shade gauge to their smile. Determine the shade and let the client know how many shades they improved. You may record this shade in their chart. Give your client an aftercare card and explain the following. 1. They cannot eat or drink anything other than water for an hour after their appointment. 2. They should follow the white diet for 24 to 48 hours after your appointment. The white diet: eating and drinking as colorless as possible. The pores on your teeth are open after your appointment and the most susceptible to any type of restaining. The 24 to 48 hour period is when the pores will close and you can resume your normal eating habits. After explaining the aftercare, advise your client to invest in their smile with these products. The whitening foam. This is an amazing day-to-day product. It is a whitening, dentist-recommended product that will maintain your results. This product is highly recommended to be used for the week after your appointment to ensure there is no restaining. The whitening pen. This is an amazing touch-up and spot treatment. It can be used for multiple days in a row as a brighten-up or as a spot treatment if you have excess staining in a particular tooth or around the gum line. These products work hand in hand and should be recommended as a package.